Even if you're an athlete without any pre-existing conditions, COVID-19 can still impact the way you play your game.
In general, pediatric patients handle it very well and recover just like they do from any upper respiratory infection or other viruses. But we are learning from several studies that have been done recently that it does seem to affect the heart.
Dr. Lanier Jackson, a pediatric cardiologist at MUSC, says that athletes who contract the virus can end up with an inflamed heart. However, it's only in rare cases.
And we can't completely quantify how frequently that occurs. So what we're trying to do by telling patients with severe infection or moderate symptoms is that it's important to seek medical care if you had a significant infection, to be evaluated to make sure that there's no signs that you have myocardial or heart involvement.
As for getting back out with the team, Dr. Jackson recommends athletes go through the full 14-day quarantine as to not pass on the infection.
I think the most important thing I can tell anybody is to listen to your body. So it makes sense, just like anything that has slowed somebody down, to kind of slowly work back into it and see how you're going to do with it. And then the hope is that you can quickly escalate and get back to the normal level of activity that you were participating in prior to your infection.
Dr. Jackson says the best way to ensure you do not contract COVID-19 on the field is to ensure that you're practicing CDC guidelines and recommendations while off the field. In Charleston, I'm Kate Prestak. Count on 2.